The root cause of heartburn can definitely be multifactorial, but the diaphragm actually plays a much bigger role than you might think. In fact, by doing one simple home exercise for the diaphragm, more than 80% of people were able to stop taking antacids. Not because they had some surgery or started some new medication, but because they practiced one very simple home exercise. And this isn't some internet hype. This is straight from a published clinical study. Now, last week, we covered the fact that antacids don't actually prevent reflux, right? They just mask the symptoms. And we also went through a lot of evidence that antacids increase the risk of bone fractures, they increase the risk of gastrointestinal infections, they reduce your ability to absorb nutrients, they increase your risk of developing food sensitivities to things like gluten and dairy. So wouldn't it make logical sense then, if you were struggling with heartburn, you would try to embrace a natural alternative that not only reduces the symptoms, but actually stops the reflux from happening? Well, a study published by Sun et al. Did a randomized controlled trial on subjects with gastroesophageal reflux disease, or GERD. Half the subjects took a commonly prescribed prescription antacids called rabeprazole, which is a proton pump inhibitor. And the other half took the same drug, but they also did a breathing exercise that retrains their diaphragm. And I'll go over those exercises in a minute here, but what the study found was that after 8 weeks, both groups felt better. But here's what happened in the long term. 6 months later, 82% of the people in the breathing exercise group had completely stopped their medication. And in the medication-only group that didn't do the breathing exercises, only 6% had stopped taking their medication. So first, let's just do a quick refresher from last week's video. We looked at this ring of smooth muscle at the bottom of the esophagus. It's called the lower esophageal sphincter muscle, or LES. It's the primary valve keeping the stomach acid where it belongs. But we also need to talk about the esophagogastric junction, or EGJ. That's the lower esophageal sphincter that we just talked about, plus something called the crus of the diaphragm. The crus of the diaphragm is a set of muscles that wrap around the junction of the EGJ externally. So here's the right crus wrapping around the EGJ like a sling. Now, in my animation, yeah, it looks like a piece of bacon. But hey, I am not a professional 3D artist, so this is what you get. And besides, everything's better when it's wrapped in bacon anyway. Now remember, the diaphragm is a muscle, right? So when it contracts, it actually pulls downward. That downward pull tightens the right crus. And by tightening the crus of the diaphragm around the lower esophagus, it helps prevent reflux. And remember, the diaphragm is a muscle. So like every muscle, train it and it gets stronger. And a stronger, more coordinated diaphragm, according to many studies, will result in less reflux and fewer symptoms. So now when the diaphragm moves downward, it also increases pressure inside the abdomen. So the belly naturally domes outward, and that's kind of a hallmark of good diaphragmatic breathing. So now we get to the key point here. Diaphragmatic breathing causes downward motion of the diaphragm, which pulls down on the crus, preventing reflux. Compare that to chest breathing, where the ribs lift up, but the diaphragm hardly moves down, so the right crus never gets that tightening pull. And when that doesn't happen, you lose tension in the right crus, and the EGJ stays more relaxed, and the reflux becomes a whole lot more likely. So here's a better clinical picture of the crus of the diaphragm and the EGJ. So you know, no bacon, but plenty of clinical relevance. So the technique used in the study was called diaphragmatic biofeedback training. It trained people to breathe using their diaphragm instead of their chest, right? Think of it like strength training, but for a muscle that helps with reflux. Now, the study I mentioned earlier isn't just some one-off study. No, diaphragmatic breathing has been used in a number of trials for people with GERD. A review of those trials was published by Zadrova et al. And they noted DBT, or diaphragmatic breathing technique, may be a useful therapeutic method in a large spectrum of GERD patients. Only regularly performed exercises have the potential to improve the anti-reflux barrier over time. And again, after reviewing the literature on the topic, they go on to say, we suggest that DBT should be part of the therapeutic approach for all GERD phenotypes, including patients with varying degrees of hiatal hernias. Now, another study followed GERD patients for 9 months. Those who continued breathing exercises had reduced acid exposure time, improved quality of life, and were able to reduce their PPI dose, their proton pump inhibitor dose, by 1/3 of what they originally needed. So, whether it's diaphragmatic breathing training or inspiratory muscle training, which is using a small resistance device to actually add a little resistance to the training of the diaphragm, the evidence is clear. The diaphragm can be trained, and it matters. So, how do you actually do diaphragmatic breathing? Well, it's simple. You don't need any gadgets, and so here's a step-by-step way to get started. Step 1, lie on your back, knees bent, on a pillow or a couch, or sit upright in a chair. Step 2, place one hand on your chest and the other on your belly. Step 3, breathe in slowly through your nose and let your belly protrude. Step 4, keep your chest still. Step 5, exhale gently through pursed lips. Let the belly fall. Step 6, repeat 5 to 10 minutes, 1 to 2 times daily. That's it. That's how you strengthen the right muscle to support the right structure to fix the right problem. But again, just like exercise, consistency is key, right? No pills, no side effects, just physiology. So many patients are looking for something that works without all the side effects that we talked about last week. And this might be it. Strengthen the diaphragm, restore pressure to the EGJ, and maybe get off the meds that you thought you'd be stuck on forever. So if you found this helpful, like it, share it with someone who's tired of chasing relief one pill at a time.